The patient should be in dorsal recumbency. Sometimes it is necessary to tilt the patient slightly to its left to improve transducer positioning for the right lateral approaches. In cats, the right kidney and adrenal are usually caudal to the last rib. Remember, transducer pressure can push the kidney out of position and invalidate it as a landmark for finding the right adrenal. In most dogs, the right kidney and adrenal are usually within the rib cage. From a right lateral sagittal transducer position, the right kidney is in contact with the caudate liver lobe. The caudal vena cava is at the bottom of the ultrasound screen, medial to the right kidney. The right adrenal is usually between the cranial pole of the right kidney and the caudal vena cava. Location of the right adrenal is variable. The right adrenal is usually between the right kidney and the caudal vena cava, that is, medial to the cranial pole of the right kidney and lateral to the caudal vena cava. However, the right adrenal can also be dorsal or ventral to the caudal vena cava. If you see the renal artery or vein, the right adrenal will be cranial to those blood vessels. The right adrenal is usually described as a comma or wedge-shaped nodule from a right lateral sagittal position. It is widest at the cranial pole and tends to taper at the caudal pole. Measure the right adrenal gland at its widest point in every patient. Adrenal length is highly variable and not a reliable normal species measurement. Right adrenal appearance may differ in the ventral sagittal view, but should still be measured at the widest point. In dogs, the normal adrenal width, or diameter, should not exceed 0.74 centimeters or 7.4 millimeters for large dogs weighing 60 pounds or more. Adrenal width in small dogs weighing 5 to 20 pounds should be about 0.5 centimeters or 5 millimeters. Adrenal width in medium dogs weighing 30 to 40 pounds should be about 0.6 centimeters or 6 millimeters. In cats, adrenal width should be from 0.4 to 0.46 centimeters, or 4 to 4.6 millimeters. Borderline measurements are probably normal. Note the dilated renal pelvis in the right kidney of this cat. All measurements are subject to operator error. Measurements of the same adrenal by one sonographer may differ from those of another. It is easy to have the ultrasound beam slightly off-center of the adrenal and to make measurements that are not at the widest point of the gland. We are satisfied if the patient shows no symptoms of adrenal disease and the measurements of a normal right and left adrenal gland are similar. If the measurements differ considerably, we recommend repeating the measurements of both adrenals using different methods if necessary.